Correcting meningeal dural fixations. 1. Dispelling the fallacy of thoracic and lumbar fixations. Firstly, it is crucial to dispel the fallacy that meningeal dural fixations occur in the thoracic and lumbar spine. This theory is incorrect. While there is tension in these areas, attempts to pinpoint and release these fixations, particularly in the thoracic region, often result in pathological collapse of the rib cage. The body more often reacts to the collapse by degenerating. In the last-ditch effort to deal with this intense pressure, the surface area increases with calcium buildup due to minor fracturing of the rib cage, especially in the lower area. Furthermore, attention can also pull heavily on the abdominal area and cause tearing in the abdominal tissues, leading to herniations popping out of those areas. This collapse also pulls the spine and rib cage forward, allowing for increased flexion not due to correction, but due to structural pathology of the rib cage and thoracic spine being pulled forward into a more anterior position and collapsing in a rotational force. Consequently, severe lumbar pain or chest spasms or head issues may arise following such stretches. 2. Correcting fixations at connection points. All meningeal and dural fixations occur at their connection points, and this is where releases should be performed and pinpointed. The twisting at these connection points causes tension, which is why tension occurs between these two distinct points from adhesions found between these points. Avoid the misconception that the tension between these areas are the same as a fixation. They are not. 3. Avoiding lateral flexion and rotation. There should be absolutely no lateral flexion or rotation of the spine during these maneuvers, as this can cause varying degrees of injury within the rib cage and rotational injuries to the spine. 4. Applying pinpoint force corrections are made by bringing the meningeal and dural tissues to tension and applying a precise amount of force to release them at their connection points. This process is straightforward and does not require the excessive force advocated by other techniques. 5. Avoiding overextension and overflexion. It is important to note that the body does not tolerate overextension or overflexion well, as it will displace the rib cage and cause overcompensation or spasms in the muscular attachments in the rib cage. The most detrimental, however, is any form of rotation that places the spine in a compromised angle and then applies pressure. Such techniques can lead to pathological positioning of the rib cage and spine. Potentially it will change structure pressure, but it is pathological nonetheless and often resulting in increased tension and dangerous situations as it collapses the body even more. Setting the record straight on meningeal dural tension release. The primary corrections needed for the body involve anterior to posterior corrections to the structures around the rib cage and the corresponding thoracic spinal areas, as well as the lumbar region, especially if the lumbar has a major collapse present. Minor adjustments may also be needed in the hips too, as the hips excessively twist to compensate for the unstable lumbar issues, and some of the compensatory twisting needs to be deleted if the body allows. However, if anterior-posterior (AP) corrections, as taught by Hydron Structural, are the main strategy for correcting the foundational pathologies that cause the body to collapse, the release of the tension in the meninges and the dura are secondary issues. There may be tension in the meningeal dural tissues that prevent you from properly sliding those structures. Anterior to posterior is needed. It is crucial to understand that techniques involving extension posterior to anterior movements are not the same as anterior to posterior corrections. It is not the fault of theses practitioners, as they have been taught wrong by other techniques. The most obvious way to identify if someone is performing an anterior to posterior maneuver incorrectly is quite easy actually, as you will see them trying to do the correction by pushing force through their arms and chest in an attempt to correct the anterior displacement. Pushing through the arms and chest will always create a posterior to anterior movement, as the angle is incorrect. Sorry to say it for most people who have been doing it wrong for many years. Hydron Structural has discovered that this problem exists. We have found a way to do the correction without pushing on the person, elbows and rib cage or AC joint, and without putting the person's body into extension or traction. This is crucial if you want to properly fix bodies, and there are a few in this community that are doing so. Learning proper techniques. It is essential to learn how to correct A to P before addressing dural meningeal tension or fixations. Most think that they're getting good results from doing excessive stretching, but they are actually making the person more pathological. The problems that they are having with doing the corrections are that they are pushing the body P to A in most areas of the body, but some are doing the lumbars correctly and the person is getting partially fixed, but the body has to twist up in a weird way because it's not being fully corrected. If people would take the time to master the skills taught in hydrostructural, it would be a much different result. The results you get from doing only anterior to posterior corrections are way more incredible than you might think. And a whole lot easier to move as well, you just haven't been doing them correctly. With hydrostructural, you will finally be able to get the body fully corrected without making a lot of mistakes. A common mistake that people make and don't realize it, is there is also an easy way to move bones posterior to anterior that they think are moving things A to P, but as it turns out, because they are usually pushing through the arms and chest, it doesn't actually move anterior to posterior. Just to clarify, this is a completely different technique. So don't get the way hydrostructural corrects the body mixed up with some other completely different technique that are totally pushing the body the other way. There is a misconception that releasing meningeal dural tension is the most important aspect for correcting the body, while neglecting to do other corrections, as it turns out is in fact a fundamentally flawed way to go about doing things. This incorrect theory has led to adverse symptoms in people receiving such treatments and is solely responsible for pushing people's bodies into other pathological positions. Debunking the adhesion myth, hydrostructural research has shown that the supposed meningeal adhesions in the thoracic and lumbar spine are largely imaginary. While there may be tension or folding in these areas, they are not stuck as previously thought. Practitioners attempting to release these imaginary fixations often cause more harm than good, by twisting and rotating the spine beyond its normal range of motion, leading to injuries and collapses in those areas. Correcting misconceptions and techniques. Hydrostructural aims to correct these misconceptions and provide proper techniques for releasing meningeal dural tension. The way that this is done, and the primary point that needs to be thoroughly examined, is that the body should never be subjected to or forced into any excessive flexion, extension or rotation. Never under any circumstances make this mistake, as this can cause significant injuries. Instead, the body should move as a single unit until the tension is released at their attachment points. That is the correct way to do the maneuver, in such a way so that the tension from the body being stretched as a single unit from the tailbone and up into the foramen magnum creates sufficient enough tension to coax the body to release these fixations. To understand how to do this correctly, hydrostructural provides the roadmap on how to safely, comfortably and effectively correct these fixations, without making mistakes or stretching in overextension or overflexion, and definitely not over-rotating the spine in any way. Also, lateral flexion is also putting the wrong pressure on the body as well. Please pay attention. Adhesions or fixations need to be corrected without making mistakes. Stop overflexing or overextending the body and eliminate all lateral flexion and rotation. The good news is that once you learn how to properly correct these fixations, eventually, there will be no more adhesions requiring correction. The most important thing is that the practitioner should be focusing on the skills to be able to correct the major A to P displacements on a daily basis without the mistakes taught by other techniques that are pushing through the elbows, arms and. If you do these corrections properly, this will cause the body to go back into its recovery position, which is the main goal of the structural corrections. It is not just a symptomatic correction or temporary quick fix. The goal should be to lead the person's body back into a recovery position. Excessive stretching is harmful and should not be considered necessary, as that is the main cause why no one in the space is getting the corrections done to cause the person to go into their recovery position. They are simply pushing their body from one pathological state to the next, and it is very unfortunate. Hydrostructural was created to correct these mistakes and to get practitioners of these techniques back on track with doing these maneuvers correctly.